Hello everyone, it's Carmen again, coming to you from the top of Lion's Head. And since posting my first video about what is integrative medicine, a lot of you have been sending me some very interesting questions. I'm hoping to get to as many of them as I can, but a question that came up more than once is how would you treat rheumatoid arthritis from an integrative medicine perspective? So in this video, I'm going to tell you a little bit more about what exactly is rheumatoid arthritis, and then in an upcoming video, I'll tell you how we would treat rheumatoid arthritis from an integrative medicine perspective. Rheumatoid arthritis is a joint disease and it affects mostly the small joints of the hands and the feet. It is a chronic inflammatory autoimmune disease. Now that is a mouthful, but don't worry, I'm going to go through what each of those mean in a moment. Chronic is a term that we use to describe any medical condition that lasts for a long period of time. There are two different types of inflammation. One that happens in the short term. All of you have had a throat infection before. So say for example, you think of your immune system like an army that's trying to protect and defend you against invading bacteria or viruses. If you get an infection in the back of your throat, you guys have all experienced the pain, the discomfort when swallowing, and even that sense of fullness in the back of your throat. That's because when you get an infection, your immune system is activated to launch an attack against whatever is trying to cause the infection. So what happens as a result of that attack is that you get a degree of tissue damage. But that inflammation doesn't last for too long, and sooner or later the tissues go back to normal. Chronic inflammation, however, is as if you get a throat infection and it never goes away. So that continuous attack and damage to the tissue is long-lasting and ongoing. And this is why chronic inflammation is believed to be the underlying cause of chronic disease. Now, what does autoimmune mean? The best way for me to describe autoimmune disease is as if the body is attacking itself. So instead of your immune system being activated to kill off a virus or a bacteria, the immune system starts to attack your own body tissues. In rheumatoid arthritis, this is happening to the lining of the joints. Now, what are some of the symptoms of rheumatoid arthritis? These include joint swelling, joint pain, and joint stiffness, which was particularly worse in the morning. Some other symptoms include tiredness, loss of appetite, and some patients may even have fever. For most patients with rheumatoid arthritis, the inflammation is localized to the joints. However, there are a percentage of patients in which the inflammation will spread to other parts of the body, including the heart, the kidneys, and sometimes even the skin. Women are more likely to get rheumatoid arthritis than men are. In fact, women are about 3 or 4 times more likely to get rheumatoid arthritis in their lifetime. Now, so what are some of the causes of rheumatoid arthritis? Going back to why women are particularly more at risk, some people believe that this is because of the fluctuating women's cycles. We do see the disease changing over periods of pregnancy and even during the menopause. Another theory as to why women are particularly more at risk is that there is a bacteria that causes urine tract infections that looks very similar to the lining of the joints. And as you know, women are more at risk of getting urine tract infections than men are. Some of the other causes of rheumatoid arthritis include our genes. We notice that it runs in families. And then other conditions that increase inflammation in the body, things like smoking, poor diet, including a high salt diet, as well as high stress levels, may also increase inflammation. So there you have it, a brief overview as to what is rheumatoid arthritis. Join me in the next video where I discuss briefly how we would treat rheumatoid arthritis from an integrative medicine perspective. If you have any questions, please don't hesitate to leave them in the comments below. And until then, take care of yourselves. Bye-bye.